That would
So
be
I
so great. Thank
usually
you.
I usually reserve or the introduction, and I record it at another time before the episode
Mm-hmm.
airs, which will probably be in about a
Mm-hmm.
month. Um, so yeah, but just a little bit of background about this podcast. I
Okay.
was diagnosed in adulthood at the age of 45 at the beginning of the pandemic, and my therapist had been sort of gently suggesting to me for a few years that I look into ADHD.
Mm-hmm.
She came to her ADHD diagnosis through her son, her middle schooler. And
Mm-hmm.
but I was actually did not, as many of the women I've interviewed have come to their ADHD diagnoses through their children, but I actually came to it through my therapist. And then it was such this profound revelatory experience being diagnosed in adulthood that I wanted
Mm-hmm.
to find out if other women were experiencing the same the same profound transformation as I was. So I started the podcast a little over a year ago, and quickly found that these discussions we were having about our lived experience were really
Mm-hmm.
resonating with a lot of other women who were sort of coming to their own diagnosis, but also women who had been diagnosed for years, but just really didn't like, sharing lived experience is so different from, reading the DSM or even just reading articles about like
Mm-hmm.
what is executive function and that kind of thing. So over the last year, it's really, it's kind of morphed more into just larger conversations about women and ADHD. You are
Mm-hmm.
my first official guest who does not have ADHD, which I sort of assumed you
Some
did.
people are not so sure.
Well, I know it was funny. I just sort of assumed you did. And then I think I was listening to a podcast interview you had given a few months ago where you actually kind of formally said, I don't have ADHD. And then
Oh, I have
that's when
some
you talked.
traits though.
Well,
I have some
exactly. And
traits.
that's what I want to talk to. I do want to get back to that and talk to you about that. But yeah, I guess we'll just jump into it if you're ready, because I'm curious.
Sure.
I know you mentioned in your book that your brother did have ADHD, but wasn't necessarily diagnosed as a child. And so I'm curious about
Mm-hmm.
sort of what your brother's story was and how I'm guessing that sparked your interest in ADHD and specializing in
Um,
ADHD.
yeah, I'll talk a little bit about that, but just I want to respect his privacy, so I'll just talk a little bit about that and
Mhm.
sort of more about how my interest was sparked and what that's been like.
Okay. Yeah, so I guess you didn't what was your experience with
Oh, you want to
ADHD?
just get started, right?
Yeah, sure, we'll just
Hello,
get
because we're
started.
already recording. Okay. So, my experience was that my brother had undiagnosed, untreated ADHD. It was the 70s. People didn't really understand ADHD that well. Um, and he struggled. There was certainly no um, kind of a pattern of giving medication to kids who were not really in facilities.
Mhm.
Um, so there was just a lot of, a lot of nervousness and explosions, and my parents struggled with him, and he struggled with them, and I tried to like do the best I could by trying to be as perfect as possible, um, which is its own set of problems.
Mhm.
And I think that what happened is that I found when I became a psychologist that I was kind of drawn to these kids, and I didn't actually understand why. And then my nephew was diagnosed at like 5, 6, or 7, and then things sort of did the course that they often do. A child gets a diagnosis, and then a parent thinks, I might have that. And so it kind of actually shed a whole new light on my understanding of my family. And I don't have a formal diagnosis, but I certainly have some traits. I struggle with emotional control and time management. I always think I could do more in a given amount of time than I actually can do. So I overestimate my ability and I underestimate how long things take. Um, and I'm an intense person, and I have sadly lost my temper more than I wish I had. As I've matured, I've really worked on that, and I continue to work on that. And I have a regular meditation practice, and I do yoga, and I exercise a lot, and all of those things help. I don't drink caffeine, never have. So, so I think that that sparked my interest, and I still feel a real, I don't know, compassion and interest in kids who are, neurodivergent, kids who have ADHD, kids who have learning challenges, kids who might be level one on the spectrum, particularly kids who live with anxiety and depression. Um, I feel like these are kids who need allies and advocates. And from my own experiences, like growing up as a somewhat as an anxious child, um, and from my family, I feel like that's my job. That's my purpose, to
Mhm.
offer people who struggle with these challenges. And, as I've progressed in my career and since my book was written, and I've sort of stumbled into also working with adults, which has been really great. Um, People like you who get a diagnosis when they're 40 and are trying to figure out, okay, well, what does this mean, when I look backwards? But mostly, and more importantly, like, how does this mean when I look forwards? Like, how do I look into the future of my life? And in, also, in my day to day present, because those, it's sort of like the present is this moment, but then there's like tomorrow.
Oh yeah, absolutely. It is I mean, yeah, it's nothing short of revelatory when I think of how there was in the very beginning so much grief looking back at, my childhood. I talk about how I was I'm born in 74. So this is like the early 80s. But in kindergarten, I was left-handed, and my kindergarten teacher forced me to become
Mhm.
right-handed, uh, which,
Oh,
right, which just feels like in the 80s,
that's
right, it
terrible.
was awfully draconian. But it was one of
Yeah.
those sort of family stories where my parents would laugh about it. Oh, isn't that funny that your teacher made you do that? And now, since my diagnosis, and I look back at all of like my handwriting issues and dysgraphia and all of these, that feeling like I had an
Mhm.
undiagnosed learning disorder, like so many of us who are diagnosed in adulthood have that feeling of like there just was something off, and the signs, now looking back, realizing the signs were there all along, just nobody knew what to look for, and nobody knew what they were even looking at, and how there's so much grief
Mhm.
around that, like wondering how my life could have been different
Mhm.
had somebody noticed. And then, like you said, now realizing, oh my goodness, like my view of who I am is changing so dramatically. What am I
Mhm.
capable of? How do what all?
Mhm.
It just feels sometimes like I often use the metaphor of the phoenix, right? Like it took an
Yeah.
emotional meltdown for me to get this diagnosis, and a lot of struggles. But now it does sort of feel like the sky is the limit. And I
Yeah.
actually have interviewed quite a few women who were diagnosed in adulthood who had a very similar experience, where they had a sibling who either was diagnosed, or just had more of the stereotypical symptoms and traits of a child with ADHD, and they were then labeled as the good kid, the easy one.
Yeah.
Don't cause problems with your parents, like we're just grateful for you, like just stay quiet and 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 don't get into trouble, and examining the anxiety that comes from that as you get older. And then you mix in the desire as a female, socialized as a female, to be likable and to not cause trouble, and the emphasis on behaving well. It just feels like the
Yeah.
perfect cocktail for anxiety, which is why so many of us are misdiagnosed with depression and anxiety. um,
Mhm.
so that
That's
brings
right.
me.
And I think that's actually what happens for a lot of women. Um, so
Yeah, exactly. Right. That was certainly my experience. I was diagnosed with depression and anxiety in university, and then when I had my first child, I then was diagnosed with postpartum depression and anxiety. And now I sort of look back and realize a lot of that was sensory issues. I think
Mhm.
we talk a lot about like the emotional regulation. I don't think I was necessarily depressed, but I do think I would kind of be thrown into a rage, not knowing why I would get thrown into a rage, and then feel like a terrible person, a terrible wife, or a terrible mother because of that rage, and going through that cycle. And now realizing like a lot of
Hmm.
that had to do with overstimulation. And had
Hmm.
I known what was happening,
Yeah.
yeah. So I mean, it's just fascinating going through and looking through all of these like life moments through this new lens.
Hmm.
Um, so now I guess going back to this idea of getting misdiagnosed and really struggling a lot with that feeling of just feeling different, or feeling, I mean, I I've certainly felt like I had a learning disorder because I struggled in school, but I also know a lot of women who are diagnosed in adulthood didn't struggle with in school. They actually did quite well.
Hmm.
So I'm curious, like, what do you think are some of the most overlooked symptoms in girls, especially in school, even if they are doing well?
Well, I think that because many girls struggle with inattentive ADHD, they don't draw as much concern because those symptoms are much more internal. You know, kind of a dreaminess, a space, sort of spacing out, a distractedness. You know, sort of it's quieter. The anxiety may be more in, it's more internalized necessarily than externalized, and so. They're not people don't see them. They may not be succeeding as well at school, or they may be doing fine at school, until they get to a place where their executive functioning challenges overwhelm their intelligence, their ability to sort of plow through material. And we usually see that around middle school or high school, and that's when we see an increase in the diagnosis of ADHD among girls.
Yeah, I think that's definitely where my issues started in middle school. And I know I've talked with many women who sort of talk about the lack of, or the reduction in structure, or I guess the sort of increase in independence, and some kids in middle school just can't impose their own structures. So when they're relying on more independence with studying and more independence with larger projects, that's where it kind of fell apart for me. But then there's also the other side of the coin, which is the hormonal element, right? I mean,
Hmm.
um, is it what would you say are there symptoms that are specific to females?
I don't think so. I think there are symptoms that are specific to inattentive and ADHD and hyperactive impulsive ADHD. And I think if we try to feminize the symptoms, then we do a disservice to boys who have inattentive ADHD. I certainly think that some of the traits for women in terms of wanting to please other people, to value themselves through their social connections and how they're performing socially, put different stressors on girls than there are on boys. Standards of being perfect put stressors on girls. I think that we see that girls with ADHD are much more likely to show anxiety or depressive signs early on, whereas we see more oppositional defiant diagnoses with boys. So I think that, I wouldn't want to sort of genderize the traits, because I think the traits are, have been researched and are, differentiated by the type of ADHD rather than the gender you have with it.
Yeah, that's a good point. I see why that could be problematic. For me, I think I feel like the conversation so often with me and my guests is comes down to like, is this ADHD or is this just being a feminist? Like, so
Hmm.
much of our the anxiety especially, but also it's really difficult to parse how many of these traits come from socialization as opposed to genetic.
Hmm. Yeah. I mean, we want to remember that, ADHD is the most inherited mental health diagnosis there is, with a genetic component somewhere between 45 and 55% of parents. So kids who have an ADHD, who have a diagnosis of ADHD, excuse me, have, a 50% chance that there's a parent who has ADHD. and that's important, but it also runs in families. So, you as a parent may not have it, but your brother might, and your daughter might, or your son.
Yeah, that's the conversation I'm having with my kids a lot of the time nowadays, because I have a 10-year-old boy and a almost 15-year-old daughter. And since my diagnosis, and because I basically am like living and breathing ADHD through the podcast and just my own hyper focus and research and interest in it,
Hmm.
they asked me that question: do you think I have ADHD? And it boggles my mind that I still don't know the answer to this question with either of
Hmm.
my children, because both of them, I think, exhibit so many neurodivergent characteristics, but they're also very different in, because of, I think one's a boy and one's a girl, one's the older child, one's the younger child. Like, so there's the birth order issue, there's so many factors leading to their traits. And then again, like, neither of them really, knock on wood, is struggling in school. But a lot of that, I think, has to do with the fact that I have been able to help them. The last 2 years have been a bit of an anomaly in terms of
Hmm.
schooling. There's no homework anymore, which is can
Right.
be great. We did so many hybrid learning and remote learning, so I was able to be a lot more invested in their schooling than I ever had been in the past. And I think they've benefited from that.
Hmm.
But it's this question of like, there are executive function issues with both of them, but at the same time, I'm like, how do I even, um, because they are so well behaved, and I think, because they uh, place a lot of emphasis and a lot of their anxiety and doing well in school and getting good grades. Part of me wonders, how do I even know if they have ADHD? Is it just
So it's
neurodivergence,
it
or is it
right.
ADHD? I guess that's where it comes
Yeah.
down to. When we talk about ADHD, are we talking about chronic behaviors or executive function difficulties that
Well,
are
it's a
lead to?
biologically based, um, you know, uh, disorder for a lot condition. I prefer the word condition,
Mhm.
based on sort of deficiencies in the dopamine and norepinephrine systems of the brain. And so, when you think about, well, like, what are some traits that we would or look for, or what are some patterns that we would look for, particularly in girls who are doing okay in school? It would have to do with, social connections and social relationships. It would have to do with stress levels related to school. Like, they may be doing well, but they may be super stressed about it and have to spend, more time on their homework than other kids. They may experience a level of distractedness, or demonstrate a level of distractedness or anxiety, worry about things that are beyond their control, that is somewhat atypical. Um, they also may feel, they may have periods of low self-esteem. So we're looking for signs that aren't necessarily just executive functioning skills. They may struggle with time management. They may struggle with being able to get started on something. They may struggle with remembering things. So we want to sort of have a broader lens that we're looking at.
Yeah, I would say all of the above with with my kids. My daughter, for instance, it's her room. Her room is a disaster. That's always sort of feels like that's the red flag for me, is the chronic disorganization, the time blindness, the like
Hmm.
you said, the inability to determine how long it takes to do things. And but again, yeah, like, I think a lot of she's very bright, and so she has not yet had to, put a lot of time and effort into school. It's come very easy for her. So I'm curious,
Hmm.
when she gets into larger, like more essays and the bigger projects that I know I certainly struggled with,
Hmm.
being, having to start large projects was always really difficult. I have a
I mean,
feeling she's going to
yeah,
have that issue.
time blindness, disorganization. You may be able to do well at school, but your desk might be, like a tornado hit it. Your room may be like a tornado. You may rush to get to school and you can't find things. You're losing things. I mean, these are all things. These are all sort of characteristics that we would look at.
Yeah, yeah. And I would say the number one question I get from women on, at least if I'm DM'd on social media, is the feeling like I am relating very deeply to ADHD literature or ADHD TikTok videos or memes, like I'm
Hmm.
feeling like I'm really relating to this, um, especially since the pandemic. I think there's been such
Hmm.
a tremendous influx of adult women who are adults in general who are getting an ADHD diagnosis since the pandemic. And along with this interest in sort of feeling like maybe I have this, I feel really seen by this. I feel really like a lot of this describes some of these seemingly random struggles I've had throughout my life. It feels like this could be the answer. And then there's also that feeling of like, well, what if my doctor doesn't believe me, or what if I'm looking for an answer and I've found, I think it's ADHD, but it's not really, I liken it to like going to the eye doctor when the eye doctor, asks you like, which is more clear, A or B? And you're like, can
Hmm.
I see A again? I don't know. Wait, what about, is it B? And then be like, who put me in charge? This is feeling
Right.
like how, there's so much self-doubt around and confusion around whether this is or isn't ADHD. And I feel like, do you feel like that's specific to ADHD? Or is
Yes.
this, yeah.
Yes. And I think that if you think you might, I mean, so there's, first of all, the question is like, what happened? What has happened since the pandemic lockdown? Why do so many people suddenly like, oh, I think I have ADHD? So I think that there's been sort of a lot of videos posted on TikTok, and people are around, they feel distracted, they feel overwhelmed, they're trying to manage their kids, they're maybe trying to work from home. This was, when kids were learning at home. A lot of us are sort of go back and forth. Like I know I was in my office seeing people masked, now I'm back at home not seeing people. So there's a lot of change, and there's a general sense of a lack of control over a lot of things. And so I think it's very hard um, to kind of determine, well, is this just depression because it's, like January and there's snow on the ground and I can't go outside because it's January 2021 and no one's vaccinated, or January 2022 when people are vaccinated and there's another, there's a variant that's keeping us inside. So, we want to differentiate between that. And I think your doctor should be able to give you some kinds of forms to fill out, to differentiate between ADHD or anxiety. And if your doctor can't, then that's the time to look for a therapist who can do that, or a psychologist who can do that. I mean, you may or may not need a full evaluation. For a lot of people, full evaluations are very helpful, but a lot of the, leaders in the field of ADHD, like Barkley and Brown, and feel like the best way to determine ADHD is actually through, an extensive interview. So you can do some sort of rating scales, and then you're interviewed at length to determine, is this more anxiety? Did the anxiety come first and then the ADHD? Is this depression, or is this ADHD with some anxiety and depression? You really have to spend some time with someone to figure that out. And I think that in our culture today, where everyone wants a fast answer, want to answer three questions and then, yes, I have this, you're doing yourself a disservice by doing that.
Mm-hmm. Yeah, I mean, I think there's also the question of self-diagnosis and even getting an official diagnosis, which I think is a conversation I have a lot on this podcast, because there are so many barriers to getting a diagnosis right now, especially, just it's hard enough to get a dentist appointment, much less a doctor's
Yes,
appointment
and
right
it's
now.
hard to find a therapist. Yes.
Right. Yeah. And so, they sort of feel like, well, what's the danger in just looking into what ADHD even is, and how, the more you look into kind of how it has maybe shown up in your life and what you can do about that. Like I often say,
Hmm.
like half the treatment is really just kind of taking the time to understand what it is and how this may have affected you, and how you can start to kind of
Hmm.
radically change your view. And like you said, start to make lifestyle choices, like prioritizing exercise and sleep and all of these things that
Hmm.
we know are going to be helpful regardless of whether you're officially
Hmm.
diagnosed or not.
That's right. That's right. And I think the idea of a diagnosis is not so you can, have a label that you can like embroider on the back of your jacket, but it's actually a roadmap. It's like, okay, if this is the diagnosis, so I've named the territory. What do I want to do to sort of live in this territory or traverse this territory? So, what does it mean? What are some common tools people use? What are other people's experiences? That's why a podcast like yours is so helpful, so people can listen and feel like they get some information and some support as well.
Mm-hmm. Yeah. And yeah, and I guess also, just like I had said earlier when we were talking, the sharing of lived experience, for whatever reason, I think has been incredibly cathartic for women who are exploring what ADHD looks like. And I feel like, even just this Sari Solden self-test that's on Attitude Magazine, which I took the original ADHD self-test that was for men and women. It was just a regular adult one. And I didn't really relate to it much because I never thought of myself as hyperactive. It was I think my story is I'm shared by a lot of adult women who are sort of like, it was suggested to me I had ADHD. I had no idea what it was. I thought of a hyperactive little boy. I thought, I'm not hyperactive. I can actually lie on the couch for hours in a depressed state. That's not my issue. I'm not fidgety or anything. And then taking the self-test and not really relating to the need to move a lot. And even though, we all are incredibly, we do, once you start to look into your own fidgets, you realize, I think many of us realize that we have them. But, the idea that I wasn't really understanding what ADHD was when it was first suggested to me. And it wasn't until I took Sari Solden's self-test that I started to realize, she talks about like how how organized your house is, and how much shame you hold around that messiness and the disorganization. And those were those like light bulb moments where I was like, oh yeah, okay, now I'm connecting the dots and now I'm understanding,
Yes.
And those are those like real lived experiences. And what was so great about your book on what your ADHD child wishes you knew, what I loved about it was how you wove in so many of those personal lived experiences firsthand from so many children of different ages. I felt like it just, rather than having a textbook that's like, dear parent, this is what you say and this is what they say, it was just so beautifully. I think there's something really, really healing, or I can't think of a different word I know I already used cathartic, but I'll use it again. Like there is something incredibly powerful about reading those vignettes and these personal experiences. And why I think
Thank you.
mediums.
I appreciate hearing that. Thank you.
Oh, you're welcome. Yeah, it's a fantastic book. I definitely recommend it for any parent out there who, or, even if you don't, I mean, I think it was very helpful just for me to recognize myself in a lot of those kids, because a lot of that adult diagnosis journey is going back and being like, yeah, I was really struggling and nobody really got it. And the signs were there. And then, so it really helped me kind of feel like, that I wasn't broken, as we often talk about, right? That there is such that belief in so many of us that there was everybody else got the manual and we didn't.
That's what's so great. My friend and colleague Tamara Rosier, the title of her book, Your Brain's Not Broken, is such a brilliant title.
Yeah.
Because so many people feel like they are broken and you're not. Your brain's just different.
Right? Yeah. So
and,
now,
and even different in what way? Like, I mean, we talk about gender diversity and racial diversity and religious diversity and economic diversity. That's what neurodiversity is. We all have different brains. And, I think that we need to honor that, just like we honor those types of diversity.
Yeah, I mean, I think for me, I've talked about this in the past, where, with my parents, for instance, I had a very kind of typical interest driven report card where I would get A's and I would get D's and nothing in between. And, there were so many times that all my parents cared about were the D's, and they would harp on the consistency, and nobody was really paying attention to the things I was good at. It was mostly just like, we always joke, if you came home with a 98, my mother would say, what happened to the other 2%? And how that kind of morphed into a sense of perfectionism, which then morphed into, well, I'm just not going to try. If I can't be perfect, I'm just not going to try. And, my parents would always say things like, well, I had two older brothers who did very well in school, always had straight A's, scholarships, Ivy League schools. And so my parents said, well, we can't all of our kids can't be perfect. All of our kids can't get straight A's. That's fine. You're good at other things. And I realize now, like, that was really damaging to me because I felt
Mm-hmm.
very bright and I felt like, why am I not getting A's? Like, nobody really is telling me how to get them explicitly, right? And so anyway, this is a little bit of a tangent because I think my point was, my own my own thinking has shifted from kind of like, oh, well, that's just who you are, to, what do you need in your life to get those A's? What do you need in your life to succeed? Um, and so I think that's really changed how I parent too, right? I used to sort
Mm-hmm.
of think of my children as like, oh, you're the good student. Oh, you're not the good student. It's so fine. You're good at other things. And
Mm-hmm.
rather, really trying to listen to, like, what do they want to be good at? What are they interested in? And how can I help them succeed in those things?
Mm-hmm. Mm-hmm.
Anyway, so going back to the idea of ADHD, the acronym, and how inaccessible it feels for a lot of people, especially adult women. If you had a chance to call it something else, would you call it something else?
That's a really fun question. Well, I think if I were going to use the letters ADHD, I'd probably call it awesomely diverse human differences.
Ah, nice.
Um, and if I'm going to call it something altogether different, I'd have to think about that. I think I might call it something like uh, something like selective attention differences, because that's what it's really about. It's about being able to pay attention to some things that you find interesting and valuable and compelling, and then struggling with paying attention to other things that are less so. So
Mhm.
I would do something about selective attention differences. Yeah, there you go. I think that's what I would do.
Sad.
Oh, but oh, that's terrible. Wait, let's redo. I don't like sad, so let's do it this way.
I know Hallowell and Radia are running with fast, the variable
I'm
attention.
not, yeah, I think I might do like maybe hmm, maybe something like differential attention, um differential attention condition. So how about DAC instead of
DAC.
sad?
That's good. At least it'll still be Googleable. That's my issue with vast. I'm like,
Yeah.
you'll still always have to type vast ADHD together.
Mm-hmm.
Um,
Mm-hmm.
so that's interesting because, what it reminded me of with the acronym SAD was the fact that I think a lot
Mm-hmm.
of women, like I did, don't relate as much to the attention focus element, right? I think a lot of us come to our own ADHD understanding through the emotional elements, the stuff that's not in the DSM, the rejection sensitivity and
Mm-hmm.
the difficulty with shame, and
Mm-hmm.
self-image, and how those are sort of interwoven into how we are treated and spoken to as children.
Mm-hmm. Yeah, I think that's true. I mean, I think that a lot of women accept and a certain level of dissatisfaction and personal maybe sadness in as part of what it is to be them, instead of feeling like no, I'm not, there isn't something wrong with me. um, that would be a great name for instead of ADHD. There isn't anything wrong with me.
Right?
You know?
Yeah, I know. I think that speaking of brilliant book titles, the "You Mean I'm Not Lazy,"
Yes, exactly.
Is it
Right.
lazy, stupid, and
Something.
crazy? I think
Yes.
those are the right. Yeah. That was
Yes.
definitely, I think, one of the best book titles to just describe that realization.
Mhm.
Um, and then I guess my other question, just going back to the idea of like, is this ADHD or is this something else? If a woman is feeling kind of like there's some gatekeeping going on from her doctor, or she's feeling minimized, like what kind of advice, we talked about this I guess a little bit, but like what kind of
Mhm.
advice would you give a woman
Well,
who
I would try to seek out someone who knows about ADHD and get a consultation. Um, and you can pursue some sort of evaluation, like a more formal psychological evaluation,
Mhm,
which is what we commonly call testing. But you know, you can also try to meet with someone who understands ADHD or is more of an expert and can give you a formal diagnosis, or you can push your doctor and say, I want to be evaluated. I understand that you don't think I have this. Then is there someone in the practice who could evaluate me who's not you?
yeah. Yeah, and there seems, this cottage industry has been building up since the pandemic around I think they're brilliantly coming in and capitalizing off of this divide between people who are seeking diagnoses and then medical professionals who are specializing in it or understand actually what it looks like in
Hmm.
adults. So there's this new industry of online diagnoses, pay $150, pay $200, and you can do the whole thing instantly online. And I have people asking me like, what, do you recommend these? And I'm always reluctant to, because I never, that wasn't my personal experience. And I haven't really done much
Hmm.
research into them. I don't know. Have
Hmm.
you, I'm sure you must get asked that a lot in terms of like, or do you feel like this is a valid route to take? And while we're kind of in this limbo right now, where how it is so
It
difficult
can
to,
be. I think again, it depends on what your experience is, what you're experiencing, and what your history is. Because you know what you're experiencing now, if it's vastly different than anything you've experienced, then that probably doesn't indicate ADHD, and it might indicate more situational anxiety or depression. But if what you're experiencing now is just an exacerbation of things that have already been present, then that's a different sort of kettle of fish and worth exploring with someone.
yeah, yeah, I think that's, that was definitely a question I asked myself a lot when I was first looking into ADHD, which was, wow, like all of these seemingly random struggles that I had experienced going back to middle school are all making sense in the, through this lens of ADHD. Um, but again, like when you get at, when I think about like ADHD is something that is present throughout your life. So you really have to kind of show evidence of struggle. And for me, it was a little more obvious, but I guess there are a lot of women who really didn't have obvious evidence of struggle in school, in early life. It was almost like this sort of building anxiety that was brewing underneath
Hmm.
from being bright
Yeah.
and being high achieving. And they're, I think they get to a place where it's sort of like, well, how do I even prove if I was struggling, right? It's a really
Hmm.
object or not a very
Hmm.
objective question for a lot of people, I
Yeah,
think.
it's true.
Anyway, well, I
But
really,
it's not necessarily about proof. It's about, you know, it's about patterns of life and experience. It's not about, you know, it's about looking at the patterns, the facts of the experiences that you've had,
mhm,
rather than, you know, I'm trying to find proof.
right.
Well, let me show you in this moment here.
Yeah, no, that's a good point. I guess I think about like in the UK, where oftentimes your parents will get pulled into it, where they'll say, like, bring your parents in. We want to know what your experience was as a child, bring your report cards, that kind of
Mm,
thing. And it does almost feel like they're being asked for proof.
hmm.
So many of
Yeah.
us, when we talk to our parents about ADHD, and they say things like, oh, all families are like that, or just don't be ridiculous. I think
Hmm.
our family members can sometimes be the biggest deniers of ADHD.
Hmm. Hmm. Yeah. And they
Well,
may have their own feelings of shame or, embarrassment about various aspects of your childhood or of their own.
yeah, yeah, that's a great point. Um, all right. Well, I really, really appreciate you sitting down and talking to me. Thank you so much. Like I said, I recommend your book to everybody, and I recommend your website. I mean, it's just such an incredible resource. Just the
Thank you.
blog, and you've done so many wonderful webinars and podcasts, and so yeah, thank you again for sitting down and sharing some of your knowledge.
Thank you so much for having me. And thank you for starting this podcast and sharing your journey with so many people. It's very healing.
Oh, I appreciate that. Awesome. All right. Well, thanks again. And like I said, I will send you the recording, and any uh, teasers or anything that I come up with, I'll certainly make sure to send them your way.
Usually people ask at the end, like, how do people reach you?
Oh, right.
So
Of
you
course.
might want to
Yes.
ask me that question so I can answer.
Um, okay. So if people want to work with you, or people want to find you, what's the best way to get more of you?
Thank you for asking. Please go to my website, www.drsharonsaline.com, which has all kinds of free resources. You can also reach me on Facebook, which is where I post a lot of things about what's happening and articles and topics of interest and um, all kinds of information for you. I do have a YouTube channel where I have videos on various topics related to ADHD. So all of those things would be great ways to reach me. And I do a weekly Facebook Live for Attitude Magazine on Fridays at 4 p.m. Eastern Standard Time. That's another way to connect and join a community of people just like you.
Oh, awesome. I actually didn't know about that. Okay. I will definitely put a link to that in the show notes, as well as your website and
Okay.
your Facebook.
Thank you. Thank
All
you.
right. Thank you again.
Nice to meet you. Thank you
You
so
too.
much. And keep going, babe. Way to go.
All right. Awesome. All right.
All
Well,
right.
have a great afternoon. Bye bye.
You too. Bye bye.